Good evening, everyone, and welcome to the 2080th day of the Uninterrupted Daily Webinar Series of the International Forum for Promoting Homeopathy. I am Arya. I'm a third-year student from Adarashramam NSS Homeopathic Medical College, Kottayam, and I'll be your moderator today. And today, our guest is Dr. Sadath Sait, Director and Chief Consultant of Dr. Sait's Homeopathy, Cochin and Alua, more than 35 years of clinical experience, and he has worked as an official in various homeopathic associations in Kerala, one of the most wanted faculty in Kerala. And today's topic is evidence-based homeopathy case presentations. We welcome you, sir. The dais is all yours.
Can you hear me?
Yes.
Yes, sir. We can hear you.
Thank you so much for inviting me for this Ifph English session. Today, I'm just coming up with my I don't know how to explain these cases, but this is a reality, and this is what we have to show it to the juniors, to the everyone that homeopathy can do anything. If I can do, everyone in this world can do it. Okay. Thank you so much once again. I'll my thanks for the. I'm going to present few cases straight away into the cases. Okay, no explanations, nothing, only pictures and what I did it for that case. Okay, picture will tell you what exactly can be done, what exactly has been done. Okay. Okay, this patient named Shaija, age 65, female. The complaint is varicose ulcers. So I don't have to explain what is varicose ulcers, how to do it, what is a pathology, nothing, because you know everything. I'm not going into the details of the varicose ulcers. Okay, because a lot of cases to be presented, location, appearance, everything you know that. I'm not going into depth of the theory. Okay, this is the presentation when I got the case. The first ones. This is the presentation of the when I got the case. No sensations. Very it is very painful. Sorry, it's very painful. But the punched out, and this was referred to the hospital for the amputation. One of my patients saw this. She was their relative, and they said, "Why don't you consult me? Then you go and amputate." So they brought the patient here. No, she called me up. She picked me up to their house, and I went and saw the case. This is the case. It's a punched out ulcer with severe pain. It is all black color, and the ulceration was on the both side, medial and the lateral. Usually, you don't see it on the lateral side, but this patient had the lateral side also. See this? Okay. See the cases in the first beginning. See the difference of the cases. Okay, step by step, I can show you the healing process. Okay, this was the opposite side. That means lateral side of the left foot. Okay, I will explain it to you once more. This is the once the wound started healing up. This is on the other side. See, the wound is healing up on the lateral side. Medial side is this. Medial side on the second picture. Just see the difference from where to where. This is on the lateral side. This was a few days back, and this is almost healed one on the lateral ulcer. So this is the medial side. What you can compare it. I'll show the photos. This is in the lateral side of the foot. Okay, different stages. I'll show you the today's photo also, how things are going on. Okay, I'll show you the pictures once more. Okay, this is the picture when I got it on the right, left medial of the foot. Okay, it's a punched out ulcer full of pus, full the foot was oozing out, and wherever you touch it on the cuff, the pus used to ooze. This was the situation when I got it, and there was a maggot also. Okay, maggots started coming up, and it was referred to the allopathic hospital, and they said it is of duration of 3 years. 3 years they treated, then again they treated, again it came back, and last they said nothing doing, we have to amputate the leg, otherwise the septicemia will go, and you have to amputate. Nothing can be done. So they said no, we will try once more with someone else, and one of the relative referred her to me, and this is the situation, step by step. Okay, you can see the wound is healing from here. See the difference of the wound on the lateral side, all granulation started coming up. Okay, see this, see this. It is almost healed, and I'll show you today's picture. Not today, yesterday's picture. I went to their house to get the review because I have to take the classes. uh, can anyone see this picture?
Yes, we can.
Okay, this is the situation now. It's almost 1.5 months. The foot of amputated foot. Okay, this one picture, and this is the latest picture with all the granulation. Now, if we don't do anything also, it will heal. We don't have to worry about too much of that. Okay, I couldn't put it because I just reached by 4 o'clock. I couldn't add this picture. Tomorrow I'll add it in the PPT. So this is one picture. Okay. Or now if you don't do anything, you just give some small medicines, you can heal that. And the best thing is what you require is a cleaning. That is something which requires a maggot. You have to use homeopathic, the best medicine which can be used when the ulcers are punched out or the pus cells are more. Echinacea is one of the best medicines you can think about it. Here, what I have done is throughout I have been giving it Echinacea 5 hours to Echinacea tincture, 5 drops every 2 hourly. First 15 days I gave it, and once the healing started, I made it into 4 times a day and 3 times a day. Now the Echinacea is I'm giving it BD. Okay, we cannot take risk on these cases because septicemia and amputation is always what I call always which hangs on our head. Amputation was prescribed for this lady, so we cannot take any risk. And the best medicines can be Merxol 30 and can be repeated to 1 m depending on the Merxol was selected because of the punched out ulcer. And syphilinum again the depth and syphilitic tendency and the slowness of the healing. Okay, Merxol 30, gunpowder. This is one of the best medicine we can always think about in such cases. Okay, and Vipera, any varicose ulcer, you can close your eyes and give it. Vipera because of the hanging aggravation. When the foot is dropped, food drops from the coat or anything of that, the pain starts. So that is the only one indication you may get in the this ones varicose ulcer cases. So think about these medicines. Plus, if there is a maggot, clean the wound with proper every day. Then hand pick if possible. Once the maggot comes, hand pick the foot. Okay, hand pick the maggots. Go there. Once we put the echinacea, it will emerge. Because I couldn't take the video, it doesn't look good on the patient. But this they keep sending me. Okay, curcuma longa, calendula, echinacea. If at all required, you can put it in that saline water or rectified spirit and just dress it. Okay, so these are the few medicines you can just think about it. Close your eyes and these 5 medicines, 6 medicines we will in any ulcer. Okay, so too much of explanation on the medicines not required. Merxol, you everyone know about the ulcers. Gunpowder stops prevents the what I call cellulitis very quick, as fast as any other medicines. One, then you can think about this medicines. Silesia also you can think about it. Too faster, all the pus can be removed. In this case, I didn't give the Silesia because I was getting good results with these medicines. Every week I used to, every day almost I used to go there, clean up. Then every week, once the granulation started coming, once in 2 days, their staff used to be cleaning it up. One care lady was there. She used to clean up, dress up, so I don't have to go. And periodically they used to send me the pictures. This is another beautiful case. Yeah. Okay, this is a case of Elsa, age 6 years, female, condition alopecia areata. Okay, different cases. I'm not talking about alopecia areata. I'm not going to explain it to you too much. Theory, I'm going to skip. Sorry. Why theory is important is how to give medicines, what is the prognosis, what all the medicines can be thought about it. Pathology is important in the case of what I call the miasmatic prescriptions, and as well as what I call to diagnose the case, to give the prognosis. Okay, theologians, all that is there, but more than anything, the picture should talk. Theory is everything you can think about it. These are the cases. Can you see the case?
Yes, sir.
Okay, this is the case of alopecia areata. Was a 6-year-old kid. Okay, and see the hair coming up, set by set. See the hair growing. One picture to the other one, the third one. Okay, this is the case also. I will explain it to you. This case I will explain to you. Just see the pictures. Can you believe this? This is the same girl. I can't show her face. I've shown that, but I have all the pictures. Okay. So this is the end result. It is all in 4 or 5 months. Okay. I'll explain it to you. Picture by picture. See this. This is the frontal hair line. There was a hair fall, total hair fall from the front also. It is coming up. You can see the small hairs which is coming up, and see the difference. The hair growth. Left hand side to my screen is Hair started growing slowly, slow and steady. And see the difference in 1.5 months. 1 month. 1.5 months is this is the difference of the hair growth. Okay. Now the kid's mother is a travel agent. She runs her travel agency and she is going to take me to the world tour. At least one destination. Okay, she's so happy. She has written a letter to me. Okay, see the front here. See this case. See the pictures. Okay, so the picture says everything. I don't have to explain anything. And she even started cutting the hair. Now that hair feels so heavy for her, since she just made it very short. She didn't send to me because I will. She thought I will scold her. Okay. Here the medicines mainly main medicines for me is I've given all these medicines once in a while. Okay, but the main medicine which in this case of hair falls, alopecia areata, I used to give syphilinum vannam because it's a syphilitic tendency. Alopecia areata is a genetic disorder. So syphilinum vannam is the first and foremost medicine. Then another medicine is acid floor. Acid floor from 30 to 1 hour. Each every 2 weeks, I used to increase with the growth. Okay. Then in this case, particular case of hepasal 1 see this all I have taken a few things in the miasmatic is syphilindum and carcinosin. Her grandfather died of cancer. So that is the only indication I got it. Case taking, she is worried, everyone, nothing big deal about it. Only thing is she has a her father and mother was divorced. That is the only trauma she has it. That's it. Okay, carcinosin is one of the best medicine. Argentum nitricum I gave, the girl showed a hyperactivity. So argentum anxiety. When the mother goes out, she calls up. When she calls up 3-4 times, anxiety was there. One time, or maybe for a week, I gave it argentum nitricum. But here in this case, you take a boric or anything, alopecia areata on the vertex and back. The best medicine can be thought as the hepasulf. Once the hepasulf was given, the result was so fast, even I was also astonished. The hepasulf is one of the best medicine even for alopecia areata. Selenium, everyone knows selenium is one of the best medicine for hair fall. Acid floor is also one of the I'm see if I can explain every bit of the acid flows, but I don't think it is required because acid floor hair fall in patches, alopecia areata, in all kinds of hair falls, acid floor is one of the best medicines. Carcinosin, syphilinum, selenium, hepacil because of the location. Okay, alopecia areata on the vertex, the location is this. Okay, that is why. See, many things we don't require too much of case taking. You can take the case, but certain pinpoints make you the prescription. You can take the case in detail and give the antimiasmatic. You get one or two. This pathology will tell you what is it. It's a genetical disorder. So what is a genetical disorder? Miasm, we have it. We have syphilinum. It is a destructive tendency. Again, we can go straight away into it. So homeopathy is so easy, so easy, so easy. You don't have to take 1 hour or 2 hour cases. You see the case, this is the medicine, this is the diagnosis, this is the prescriptions can come. These are the money. If you get a PQRS symptom, if you take the case in detail, if you get any PQRS symptom in taking cases, you can prescribe that. You can add that medicine if you want to. Not if you want to. If that PQRS symptom will make you the prescription, you have to prescribe that according to that, and the results will be faster because of I like hepasol. Location was the key factor. I took it. And HEPA self covers the anxiety also. HEPA self covers the hyperactivity also. All the kids was too what I call always in an angry mood because of this frustrated mood because of the all the what I call life situations. Okay, and she was much better with this. And the one more thing I have used is I used to make one oil, and these are the medicines in the oil. Sabalserolate I use, Tifisagra I use, Amloki, Belson. That I make an oil with it. Coconut oil and castor oil are the base. Castor oil is 10 or 20%. If you take in 100 ml, 10 or 20% plus coconut oil. Okay, these medicines will absorb from the skin, the hair. These are all in tincture forms, and these are the oil. Mix it and give it on the spot. This is the ingredient in every case of my hair oil. And one or two medicine, if required, I will add it. Otherwise, this is the general hair oil. Okay. This is another case. Jaya Thomas, age 49, condition is carcinoid tumor with liver metastasis, fatty liver, multiple target lesions scattered in the both lobes of liver with metastasis, cholelithiasis also, carcinoid tumor. Okay, carcinoid tumors. I will just give you one or two lines of carcinoid tumor. You can go through all the text or Google it or Wikipedia. You can use it for the details of because we don't have time. It's already 8:39, I think so. 9 o'clock. So we don't have too much of time. So carcinoid tumors with the liver metastasis involve slow growing neuroendocrine tumors, often originating in the midgut. So almost in the cecum and the other areas, spreading to liver. This spread frequently triggers carcinoid symptoms, flushing, diarrhea, wheezing. Management focus on the symptom control and tumor reduction through surgery. Hepatic artery, no. Tumor reduction, not with the surgery. This is the basic theory is given in the textbooks. Okay. Hepatic artery embolization and the somatostatin analogs 5-year survival at 40 to 70. Okay. Liver spread. Involvement is the most common site of metastasis to gastrointestinal for the gastrointestinal. All that carcinoid syndrome. Symptoms when metastases are present in the liver, serotonin and other hormones produce a tumor bypass liver metabolism, entering systematic circulation to cause a flushing, abdominal diarrhea, heart wall issues. Okay, and these are the reports. You can take it from the. These are the reports of the patient. Okay. Time to time PET scans are done. Okay. And the best thing is time to time PET scans, time to time, even oncology, time to time consultation is going on. Okay. These are the case. See, huge reports are there with me. You can go through every report. And the best thing is she has gone to Europe second time after this treatment to travel to. They are touring the world. Everything is better. All the parameters are good. Liver, what I call metabolism, liver metastasis is under control. The growth has come down. You can go through all the scan reports. Okay, it is in the YouTube for you to check it out. All the parameters are better. She and her husband is traveling. Last time she went to Jerusalem, came back and gave me some sweets. This week, last month means 2 months back, they had gone to Jerusalem for 10-15 days when the Iraq war started. Okay, and they came back in another next this week, I think today or tomorrow, they are flying to Europe. Okay, and she's having a home nursing association or something of that sort. Okay, and the medicine I've given is again carcinosin, 3 pills bedtime, conium mac, plumpam. This is this one, ornithogalum ampullatum. Ornithogalum has a specific action on the cecum and midgut. Any growth, any tumor. Okay, Calmec is one of the best medicine. I can tell you from all my experiences, you give it blindfold also, it will reduce all your SGPT elevated, alkaline phosphatase, all the enzymes which gets elevated in the liver functions, that will bring down drastically. Calmec. Hydrastis because of the hydrastis because she had once in a while she had a gastritis because of the cholelithiasis. That is also taken care. Natramure because of her mind. Okay, I have given 3 pills at bedtime for few days because anxiety to be cleared. So for that I give Natramure 1 m. Why 1 m? Because her anxiety, when it was diagnosed cancer, she had severe anxiety. That is why I gave her Natramure instead of Ignatia. Okay, I usually prefer Natramure for this kind of grief, all that anxiety issues. Pituitary 30 because she had developed pituitary was again given for the growth, like thyroid, for the growth, any growth. Okay, pituitary will act, and all the hormones can be brought down with the pituitary. If it is affecting, if it is metastasis, that also can be controlled with the pituitary. So pituitary is a hormonal this one, anything which acts on the pituitary gland, plus theoretically or therapeutically, it cut shorts the metastasis. And she's wonderful. She's enjoying her life. She's going around. All the parameters we associate with the oncology department of Lisi Hospital, they are too friendly because they are seeing the results. Again, the Plumpamet, same effect. Plumpamet is too good for the any colon, any growth or any changes in the villi of the intestine. Okay, Plumpamet is one of the best medicines. This is time to time. I have added it because it's a case of 3 years. Scrofularia nodosa, that is again another beautiful medicine. Scrofularia nodosa, cholestyrinum 3x can be given for the cancer of the liver plus cholelithiasis. Feltori is again the therapeutic, if you take it out, therapeutic medicine for the cholelithiasis. Nothing too much of it. And the results you can see it in the all the scan, CT scan and the PET scan results. Okay. So these are the medicines of 2.5 years treatment, and it is going on. And she's happy, and I've reduced all the medicine. These medicines are given time to time. Total correct, I can give you the prescriptions if at all you require it. Iris 10x is one of the best medicine for gastritis. And what is Iris 10x tell you? A heartburn from throat to anus. That is a symptom for iris 10x. You can give that medicine almost like a specific for the heartburns. Okay, so these are the cases which comes to me very this one So we have to do something to bring back the patient into normal, and they have the confidence. Now I've reduced almost, now she's under 1 or 2 medicine, one medicine, carcinogen always there. Then depending on the symptoms she comes in, that's it. It's a symptomatic now. She is mentally healthy, no anxiety. She is running around. She is going to the places. She finished at least 4 5 foreign trips. Okay, enjoying her life with the family. This is a case of atopic dermatitis. You see the picture. Picture will tell you everything. This is random one. Huh? When I got the case was like this. See, this is the healing stages. You just see the pictures randomly and you will understand the case. Cellulitis. I will explain to you step by step. See the last picture. What else you want? Evidence-based. Total evidence-based cases. No one can say that homeopathy cannot treat these cases. This is the condition. It is all in 1.5 months. No cellulitis, no septicemia. Okay. See the pictures. I will explain you to the cases. You can diagnose. You know the diagnosis by seeing the case. By now. Okay, this is a case of atopic dermatitis, which is caused by the Ayurvedic that what I call bandage medicine. She bandaged with Ayurveda. She had come to me She has a severe osteoarthritis. She came to me once. 15 days of medicine, it didn't give her any result of the osteoarthritis. Pain didn't subside. And as practice in Kerala, they directly go to the Ayurveda for the osteoarthritis cases. And once she was in Ayurveda treatment, that they did a what I call bandage with some Ayurvedic products, and she came to me with this. She came to me with this picture. I think this. This was one presentation when she came from from the knee to the toe. This one. See this. This is a healing stage. I'll tell you I'll show you the photo when she came to me. This little more, one more. This was the condition. See the ankle and the foot and the knee. This was the condition when she came to me. I was also scared because I was expecting a cellulitis faster, because now this is it has affected on the thrombosis. This one, deep vein thrombosis also I was expecting it. So no one to explain it to me. No one has the experience of treating these cases. And this is one by one started healing. See this left hand side, my left hand side. See the that skin peeling off, the skin getting dried. This is total what I call oozing. It was a fluid inside. Okay. See the cases. It is healing one by one, one by one. Every step, it is healing. See the knee now. See the knee and the calf and shin. See, it was totally oozing. Oozing has this one stickiness. When I said stickiness, you know the medicine. See the dryness. See every step. See, it is healed. Okay. So this is something which nowadays we get the cases. Okay. Again, medicines are the same, which I gave it to the ulcers, gunpowder, rustox. Rustox was one given additionally because I have to keep changing. One day it was showing better, one day it was not healing, one day the secretion was too much. So every day I have to monitor and I have to change. Every day I have to change. Epismel, when the bulle was there, it was oozing. The total bulle formation was there, it was oozing. Calotropis is another one medicine where I used in this stages. This stage. See this right side. Calotropis is one of the best medicine for this kind of stages. These stages. I think this stage also. This see the bulle and it was oozing total liquid that it was not a pus, it was only a water, this one serum. Okay, then every side when this started, this is the stage I used the calendula. Okay, internally and echinacea internally. So this kind of treatments has to be done step by step. Staphylococcin is one of the best medicines to prevent cellulitis, to prevent bacterial infections. Okay, petroleum, when it becomes started drying up, echinacea, episma, these are the medicines which is every time you can use it. It's a common medicines, nothing big deal. Calendula dressing, echinacea dressing, and echinacea you can give it internally to prevent any kind of septicemia. Okay, I will skip this case. I wanted to show one case came few days back. I'll show you another case with few days back. One beautiful case. I got the permission from the patient. It is hardly a week's time. Editors, please, I couldn't do anything. Once you edit it, just do something with the face, okay?
Sadath Sait left. Maybe due to the problem. Dr. Tanesh, any information?
Yes. Hello. Oh. Yes, doctor will be joining soon. As we all know that these are some of the conditions which are quite common with patients, but unfortunately, most of them are going towards a surgeon as well as a dermatologist for consultation and treatment. But when they are not getting proper cure for such a particular disease, then they search for somebody who can do some miracle like that. Then only they realize that homeopathic, somebody may tell them or direct them, you may go to a homeopathic doctor who can do wonders for you. So in those conditions, when a patient visits you, you just observe what you see in front of you, and try to take the photo out of this. That's what the doctor Sadath was doing. And if you keep this thing as record, that become an evidence. Once you cure the case. And we need to publish these kind of successful stories to public platforms. So then only people will aware about, we will be able to know about homeopathy and homeopathic possibility of treating such wonders with wonderful cures of homeopathy. So, so what we need is we need to take these photos as well as videos and what the patient is telling uh, about her symptoms and what disease and how it had developed and how it reached to such a particular level, and then what are the treatment undertook by the patient for that. Sometimes the patient may take allopathic medicine, homeopathic medicine, and even Ayurvedic medicine. But the thing is that sometimes the patient may be forced to do some surgeries for that. But even after surgery, patient may develop this kind of secondary problems, and the same symptoms can occur on the same part or sometimes in different part or in the different side of the uh, uh, person. So a thorough study of the case is necessary, and knowledge of machinery, because Dr. Sadath was prescribing in a pathological way. That's the reason why he is using so many medicines, because only an experience, we have a machinery called boric machinery, in which you can see lot of rare remedies in it. And the thing is that most of the homeopathic doctors are not aware about the how to apply these rare remedies into each and every case. But when there is a standstill, while you treat the patient, you can use these medicines as supportive medicines, or sometimes that itself will cure the case. For example, if you have a varicose ulcer with pain and still it is not curing, after the constitution medicine, sometimes this tincture form of our potent-based medicine or vipera may do wonderful result in those cases. If it is the exact picture of vipera, definitely it will cure the case. And you can repeat your constitution medicine once the cure has happened for preventing the second part, if necessary only. If there is repetition, some people may say that, doctor, every year this is happening. So if that you can take it as a rubric. Diseases occurs annually, and in those conditions, lactose is a wonderful medicine for that. Whether Dr. Sadath has joined or not?
Not
Sadath?
that joint, not that joint.
Yes.
What happened? I don't know.
He told me that he will be joining shortly.
Yes. As cited, mentioned by Dr. Dhanesh, the common man who is aware of the possibilities of homeopathy will definitely seek the alternatives. At that area, we have to capitalize by more intensify studies as well as publications. What is more remarkable and interesting is that Dr. Sadath Sait always records all these cases, that too in a beautiful manner, and then ease of doing business rather. With easily he describes all these things. That's most important. As he joined, Dr. Sadath joined. Yes, Dr. Sadath Sait, you can continue, Dr. Sadath, please. Yes, you are the co-host, you can continue, please. Please unmute now. Yes, okay, please. Again muted, again muted.
Okay,
Right,
there was a
okay,
net
please.
issue. Just 2 minutes. And this happens. I don't know, there was some net issue.
Could you talk please, a bit louder, please?
Yeah, there was some net issue, just little panic because of that. I wanted to show that case, which is a beautiful case of ichthyosis. Okay. Let me just bring that to that case. Straight away you can come. Just give me a second more.
So we all know that today is the International Nurses Day. And we have program Malayalam at 9:30 soon after this program. Yes, Dr. Sadath Sait, please.
So I have the time. Do I
You
have
can
time?
you can do without screen sharing, don't worry.
No. This case without screen sharing, nothing can happen.
Okay, okay. Yes.
Can you see?
No.
Okay.
Please restart.
No, sir.
Okay.
Please share.
Okay, one second. Now I'll share this. Okay. Is that okay now?
It started.
Can you see?
It started. Just started.
Can you see the this picture?
No.
It is
No.
about, please wait. Because of low network, it will take time. So you may continue with your story.
Now.
Yes, it is coming. It is coming.
This boy is 10 years, came with complete ichthyosis, full dark. You see the head. It's a case of just one and a half weeks. Just nothing big deal you got that. But this case, you have to see this case because we are too fortunate. And so see the difference in a week's time. See the difference. Okay, see the color changes, skin, what I call, see the difference. Okay, see the head, hand. Okay, this is in 4th day. I think this picture is a 4th day. See the difference. The color is fading. Head color, it is totally. It is that blackishness is lightening now. And see this skin is peeling off. Okay, from the hand. This is a typical case of ichthyosis, a severe case of ichthyosis. I was just wondering to take the case or no. But one symptom he told me was the skin is peeling off. Once he said that, while I was taking cases, it is from his birth. He said on and off the skin is peeling off. The only medicine was in my mind was lacasis. And the 3rd day, 4th day, they were too excited. They had sent me the photos. Rest of the photos they have sent to me. These are the photos they have sent to me. Okay. Because I was so nervous to take this picture, what the baby kid will think. So they had sent me the pictures. Once they took the medicines from my side, this is the first picture they sent it from my house. These 3 are the first pictures. Okay. And later, after a week, see the difference. Not after a week, 4th day. Not even a week. See the face. Okay. See the head. See the legs and head. See this. The medicine given was lacasis. Okay. So I just wanted to demonstrate this. Okay. Okay, just wanted to put that mask of the face. Please think about it, the editors, before you put it. Okay, that is the case. I just wanted to show it. It's a week's time and it is much better with lacasis. And this is a case of renal calculi. They had sent me this medicine, was given it multiple calculi. See this, 2 of them has gone. And rest everything is gone. Now she is much better. With the closet also, with the picture also. Okay. Medicine, normal, this one. Calculus renalis is one of the medicine I gave it. In this case, Epigea 30 was given. Pitchy is one of the best medicines for calculus renalis. Then hydrangea and all that. This I've told them to take it every 1 hourly, one medicine every 2 hourly for 2 days. And this is the result after a 4th day or something. Epigea, Cantharis, and Pitchy. These 3 was given, calculus, this 3 was given because I was not getting any result after a week also. So I said, you take this. And this is the result after a week.
Doctor, you have 5 more minutes because we have
Okay.
to wind.
So I think we can go for a discussions. Is that okay? I can come up with the next class.
Okay,
With
sir.
the okay, no issues.
Please,
Okay.
please explain about this utility of this method of medicine for this particular disease.
Which one, sir?
Hydrangea tincture, calculus renalis.
Calculus renalis, name tells it, calculus renalis. You don't have to think too much about it. Epigea can be given to break that, this one, what are called, renal stone. If the cases of multiple stones, you are not getting any other symptoms, only pain, left, right, modalities, multiple stones in the both, this one. Lyco has the right, Lyco has the left, and Berberis vulgaris has, this is multiple stones. Calculus renalis is almost specific.
Whether you are giving this medicine at one by one or in a
One by one, sir. 2 days I will see if one medicines. If there is no results of that doesn't break down, I will change the medicines. I used to send the medicines and one by one explain this is it. Ask them to call me up if it is required, and I will explain after first day, second day, or third day, fourth day. First day you have to take it like this. This hydrangea has to be taken 10 drops 4 times a day for 2 days. Then if it's not, calculus renalis, and if the case is severe, I had to give, the pain was severe, I gave calculus renalis and Epigea together. Okay, for another 2 days. No results, it didn't come out.
You are giving 35 drops, whether it is diluted in 5 drops of water or you just give 5 drops.
No, what I used to do is ask them, I used to put 10 ml of medicine in 30 ml dropper, then add water and give it to them. It is not because of that. It is because the patient doesn't have to take water, then put it again, then do it.
Okay.
So instead of that, we just dilute it and give as the concentration required, give it. Straight away 10 drops on your tongue. So that patient doesn't have to take all the water, then put 10 drops. The dispensing becomes easier for the patient. Okay, that is the pitchy again, it breaks down. Cantharis also, you know that Cantharis is given to break down. So how fast you want the results, that's my concept. My concept is not the single medicine at a time you can give it. I'm not against combining also, but if you want a result, you have to be repeating the medicines faster, because at 3 mm, if breaks out 3 mm, this one stone breaks down from the tip, rest will come down faster. Okay, so 3 mm has to be more, 4 mm has to be made 3 mm faster. So frequently give the medicine, 3-4 days you can give the medicines, it will break down, and ask them to do plenty of water. It will break down and come out. Once one medicine, this one, in the case of multiple this ones, one stone if breaks down and comes out, others will follow faster. Our medicines will act faster and it will follow and come out faster. Okay, so rest of the things have gone into the toilet maybe, and she is much better. Scan report has been done, everything is okay.
Can we wind up, sir?
Yes, you
Yes,
can.
yes, please.
Okay.
Thank you, Dr. Sait, sir, for that wonderful session. We've had, even though we lost some time, we had a wonderful session, especially for a student like me. I could see many therapeutics that you have used, especially in the case of ulcers, which we find here in the IP and or most commonly. Also in the cases that you presented of an alopecia case, which was also, it's great to see such cases like this case presentations with the photos. So thank you very much, sir. And thank you to all the members who have participated in this webinar. Thank you, everyone.
And tomorrow we will have a session from Dr. Manish Singh as well. Hope
Okay.
all of you will join.
Sure, sir. Okay. Moving, handling to the Malayalam session. Thank you, everyone.